Hey everybody, thank you for joining me today. My name's Gina Empey, and this is a discussion on Bartonella. Now that's short for Bartonellosis. This is something that's a major problem right now that people aren't aware of. There's like 40 different species, if not more. And that, the ones they test for these days is cat scratch fever, but there's so many other kinds that it's very difficult to get a positive test on this thing. So it's a lot about having your doctor take a look at your symptoms, and it's a clinical diagnosis is how they figure it out. It's like, what kind of symptoms do you have? And so I want to share this with you, is that there are multiple different ways to be transmitted with this. It's either the ticks can be it can be the black flies, it can be mosquitoes, cat scratches, multiple different ways to get it. So that's important information. I had this way back in 2009 when I had got bit with my tick. What I ended up with, luckily, was a big bullseye, and in the middle, I had a bunch of blisters. Now I find out many years later that those blisters are a sign that you have a co-infection. So I had Bartonella and Babesia at the same time. So just staying on track with Bartonella, this thing's a big deal. These were some of my worst symptoms that I experienced. I had things like neurological things where my mind wasn't thinking right. My eyes weren't seeing correctly. Sometimes I would be able to see really good, and other times I couldn't see very well at all. My teeth would shock me. All of a sudden, I feel like I had shocks in my mouth, and I thought I needed root canals when it wasn't. I didn't need any dental work whatsoever. And after treatment, this all went away. So I've known people that's had their teeth pulled with so much pain in their mouth, not understanding that it could be something like this and could be treated. The other things were deep hip pain, just so deep down in the groin area where you just can't hardly pull yourself out of bed. My head moving around, without me telling it to, almost like Parkinson's or something similar to that. One time was asked if I had MS at the doctor's when I was giving blood because my head was moving around and I wasn't telling it to. It was very, very scary. So these types of symptoms can be going along with Bartonella, along with having sore soles on your feet, getting out of bed and barely be able to walk across the floor. You can have GI issues where your guts just you're having pain in your intestines, ankles, stiff ankles. It just goes on and on. So there is a really good video that there's a link to. I'm going to put it in the bottom of this description box. That's Unmasking Stealth Infections by Dr. Joseph Burrascano. It's the best I've ever seen. He names off the different animals that have this. He names off the different vectors that can give it to you and all those types of things. It's just super good with all the statistics. And so, but what I wanted to do is just tell you the things I did for mine in case this helps anybody. And boy, if I would have known that that blister meant I had a co-infection right away, I would have been able to go at it with other means. There's antibiotics and there's herbals, and I've learned all these things now, and it's just been a real puzzle. But first off, what I was clinically diagnosed, and at that time I had a doctor out of Wisconsin that was just amazing, and he said, you know what, we're going to hit it with rifampin. And I'm going to put all these different things in the notes so you can see exactly what I did in case this helps you in any way. So rifampin, it was 150 milligram pill. He had me start out slow. I took 2 in a day, then pretty soon 3. And then I worked up to 300 milligrams twice a day. I mean, I'm just going to give you this information, and you absolutely, if you have a doctor or naturopath, definitely talk to them because I'm not a doctor. This is my experience. But I took that stuff for 3 months. And I could feel things changing. I could get a temperature of 99 in the afternoon. That's indicative of Bartonella big time. Generally, our temperatures are a lot lower in the morning when we have this type of thing going on because the bacteria dials down the hypothalamus so that our bodies stay colder so they can multiply. Bartonella is one of those things where it usually multiplies about every 2 weeks. So it's important to note if all of a sudden you're having these symptoms fire up more in a 2-week cycle, that could be another giveaway that you're dealing with this stuff. So the next thing he did is he added rifampin to doxycycline. So he put me on that for 3 months. I mean, I was on that, and then doxy, are rifampin and ceftin. So he kept changing those antibiotics on me so that it would kind of trick everything, because I was dealing with him trying to get the Lyme under control and the Bartonella at the same time. So I'm going to put exactly what I did in the description box below so that you can at least see these things. And then also I wanted to talk about the herbals. So since then, now, it's just so many things that are out there that are a little easier on the body, in my opinion. Japanese knotweed is great for helping get rid of Bartonella. We have Dr. Bill Rawls has a good video also link that I will share in the bottom box. But so Japanese knotweed, along with there's other things that you can use. For instance, resveratrol. Resveratrol is similar to Japanese knotweed, but it's a capsule. And sometimes they put a little grapeseed extract in there. So there's a lot of different things you can do. And for me, my way of knowing if I had this stuff is what I would take my treatment and then I would wait and take my temperature. And if I got a temperature, it kind of gave me an idea that, hey, this remedy is set up for killing Bartonella. And if it's not Bartonella, it probably isn't going to do anything. So all of a sudden, when I get that 99 temperature, it was a dead giveaway. Okay, I'm on track. And so, of course, start to feel worse because you're all of a sudden killing the stuff. And then you have the neurotoxins that break free in the body. So it's quite the process. And, but it's very well worth doing. As you can see, I'm standing here right now and my head's not moving by itself. I am able to live a normal life and keep this stuff in check. So I really want to make sure everybody can see everything that I did. Also, just knowing that with Bartonella, many times you can have this without having even Lyme disease. It can come, like I say, from a cat scratch. Your kids, all of a sudden, your kids start having some kind of odd symptoms and stuff. It doesn't hurt to get it checked or take note and have a doc that knows a little more about clinically diagnosing in case, the child has chronic fatigue. That's a huge one. All of a sudden you think your child's lazy and it's not at all. He's tired because he's dealing with this bacteria. So I'm going to go ahead and put the stuff in the notes, put those links in there. This is so crucial that everybody knows that there is multiple different kinds and that it can come from different vectors. And also just that there are treatments that can get you better, and just a matter of kind of writing down your symptoms and then keeping track of your temperatures can be a huge benefit in my opinion. So I'm going to sign off today. Please let me know if there's anything in the comments. If you'd like to hear more about this, I would like to make as many videos as I can to help with this in any way I can. So thank you so much for watching. Have a wonderful day.